Morning, I'm Nigel Booth, and this morning I'm going to be demonstrating the examination on the hip and the groin. And with me here is Stephanie.
Hi.
And as sport medicine personnel, we are called upon to examine the hip and the groin for patients having pain or possibly a limp. And it must be recognized that for patients with pain, pain in the hip and the groin could represent a referred pain from the back. So an examination of the hip and the groin would not be complete without examining the spine. So from here, we'll just get Stephanie to turn around. And first we need to check to make sure that there is no tilt of the pelvis, that the pelvis is squared, just resting on the iliac crest. To make sure that there is no evidence of scoliosis or twist of the spine, and that is straight. Just get her to turn to the side. And we're looking at the kyphosis and lordotic curve to make sure that there is no exaggeration of these curves. Okay, from here, we're going to get Stephanie to do a walk. And with Stephanie walking, we're examining to see if there's any evidence of pain or any suggestion of a limp or any instability of the spine, of the pelvis, which may be demonstrated by the Trendelenburg sign, where she gets a fall on that side of the hip that is off the ground. From here, we'll just get Stephanie to sit. And with Stephanie seated, again, we're going to get an examination of the spine to look for scoliosis. Palpate along the SI joint, feeling for tenderness, any pain. Now as she sits, the pelvis is stabilized, so this allows us to do movement about the spine. So forward flexion, Stephanie. Okay, backward. Okay, rotation. Flexion. Okay, so that's very good movement of the spine. From here, we're going to move on to get Stephanie to lie. And with Stephanie lying, we're testing to sensation of the foot, and that's testing the nerves from the back. Do you feel me touching you?
Yes.
And is it the same on both sides?
Yes.
Okay, then we're going to test strength of the ankle flexion. Push your foot down. Okay, up. Foot down. Up. And from here we'll do a straight leg raise just to check for any evidence of sciatic irritation, and if there's pain, dorsiflexion would make this worse. The flexion of the knee or plantar flexion would relieve that pain. And in addition, we must recognize that pain in the groin could represent pain referred from the abdominal muscles, and at this point we probably need to examine the hernial orifices, looking for a cuff impulse, but we'll save that for another time. From here, we'll move on to do palpation about the hip, and we'll start palpating at the anterior superior iliac spine, which is the point of insertion of the sartorius, the anterior inferior iliac spine, which is the point of insertion of the rectus femoris, and we're feeling for pain, any pain, along the pubic rami, the symphysis pubis, which may be tendon osteitis pubis. Any pain? Roll on the side for me. Palpating along the iliac crest, which is the point of origin of the abdominal muscle. And from here we move on to do the palpation along the ischial tuberosity, which is the point of origination of the hamstring muscle, and on the greater trochanter, which is the point of insertion for gluteus medius and minimus and piriformis. Okay, from here we're going to be moving on. Stephanie, back on your back. And with Stephanie on the back, we'll do range of movement of the hip, starting with flexion, and we're going to be doing comparison on both sides. Internal rotation, external rotation, abduction, adduction. And we just need to compare the range on the opposite side. Flexion, external rotation, internal rotation, abduction, adduction. Then we'll get Stephanie to roll onto the tummy, where we can also check extension of the hip. And with our line, we can also do external rotation of the hip. Fine. From here, we're going to be moving on. Roll over for me, Stephanie. And with our back on the back, we can check to see if there is any tightness of the hamstring. So if you do flexion of the hip and the knee, and extend. If there is any hamstring tightness, you would not be able to get full extension of the knee. And we can also do a Thompson's test to see if there is any evidence of tightness along the iliopsoas. From here, we get the patient to bend both legs up, hug the knees, this leg down, and if the iliopsoas is tight, she's not able to get the leg all the way down, and we're just testing on both sides. Okay, good. Legs down. From here, we're going to be moving on, and we're going to be testing muscle strength about the hip. So we're going to be starting off by doing strength of the quadriceps, straight leg raise for me. And a straight leg raise is a quadricep function. Bend the knee, pull the hip up. That's the test of the iliopsoas. Okay. Pull the legs together. Test of the adductors, legs out. Test of the abductors. Push the leg down for me. Test of the extensors. And from here, we're going to be moving on, and we're going to be continuing to test strength of rotation about the hip. So with our flex, put the leg in for me. Put the foot in like that for me. Okay, so we're testing external rotator strength. Push the leg out like that for me. Internal rotator strength. Okay, and we're going to test the sartorius. And the sartorius is a muscle that runs from the anterior superior iliac spine to the tibial tuberosity. It crosses two joints, and it can be tested by just getting them to rub the leg along. Okay, and that would test sartorius function. Okay, moving right along, we're going to be checking now with pain of the hip. You know, one of the possibilities that there could be stress fractures of the neck of the femur. So this could be made worse by tapping. Any pain in the hip? Tapping at the knee. Pain in the hip. On the greater trochanter. Pain in the hip. Or doing extremes of rotation about the hip. Any pain in the hip? Okay. So we're going to be moving on from here, and we're going to be testing from this any evidence of any snapping of the hip. And snapping in the hip could occur from, you know, one of three possible places. It may be a result of loose body in the hip, which gives an anterior snap, and iliopsoas snap, which is anterior, and snapping from the iliotibial band, which is the lateral aspect on the knee. So we'll just move on to demonstrate. First, iliotibial snap, and iliopsoas snap. For iliopsoas snap, what we do, we'll flex, externally rotate the hip with the hand inside to feel, internally rotate and extend. Again, flex, externally rotate, the hand inside feeling for snap, internally rotate and extend. Okay. From here we'll move to get around to the side, moving on to do a iliotibial band snap. And with the iliotibial band, what we're doing is holding the leg, feeling for a snap, with the leg in and doing internal and external rotation of the hip, feeling if there's any snap along the greater trochanter as the iliotibial band passes over the greater trochanter. Also, with patients with iliotibial band snap, they may have tightness along the iliotibial band, in which case as they rest the leg down, if it's tight, the knee does not come down to the other side. Okay, moving on, just get our back on the back. We're going to be checking to see if there's any intra-articular snapping of the hip. So from here, we'll flex the knee and the hip. We'll do internal and external rotation just to see if there's any loose body or labral tear. Get that out. Extreme flexion internal, and do rotation, feeling for any snapping along the hip. And there's no evidence of any snap, and we do that on both sides. And then moving from here, we're going to be testing just to see if there's any evidence of any SI joint pathology. And this can be done by doing a Faber's test, where you get the patient flex, stabilizing the pelvis. Any pain along the back? No. Okay. Roll onto the side for me. Compression along the pelvis. Okay. Any pain? Any pain in the back?
No.
Okay. Stand up for me, please. And with our standing, we could do the stalk test. Stand on one leg for me and rest back. Okay, any pain in the back?
No.
Okay, fine. So with this, we've completed our examination of the hip and the groin. And as you can see, we did special tests just to test for any problems with the SI joint, snapping of the hip, any evidence of any fracture of the neck of the femur. And this completes us. Moving on.